Hello, folks. I'm Arlington, Texas Mayor Jim Ross. You know, unfortunately, gun-related injuries are far more common than we think. For years now, death rates from gunshot wounds in the U.S. has increased 10 to 20% each year. More than 100 people died and more than 200 people were injured by firearms every single day of 2020. Most of these deaths, as in each and every other year, were gun suicides. Each firearm-related injury and death leaves behind a trail of physical and emotional harm, post-traumatic stress, medical and funeral expenses, and lost wages. We must meet this challenge by approaching firearm injury as a public health epidemic rather than a debate about gun rights or control. This is what we've done for the coronavirus. We've tested. We've proven that masks and vaccines make a difference, and now we're on the road to ending that pandemic. We've done this before. In the 70s, car crashes were thought to be inevitable. Since then, death rates have decreased by more than 2/3, despite there being many, many more faster cars on the road and millions more miles traveled. Instead of trying to ban cars, we used good public health techniques. We improved car safety through engineering. We educated parents about the importance of child car seats. We passed laws about drunk driving, and we funded research on how to make us safer. Finally, a successful public health approach to firearm injury requires that we stop pointing fingers, and instead we start working together. Some of the most promising approaches to firearm injury prevention are true partnerships between those who are experts in firearms and those who are experts in health. Because honestly, both sides of the debate are right. Yes, we'd have 0 gun deaths if we had 0 guns. But a gun does not go off on its own. There is always a person behind it. The public health approach requires we talk about both the object and the person. So please, let's do what Americans do best and stop fighting each other, start working together, and take care of one another.